So Twitter went crazy last week over the first story that we're going to cover. White House to hospitals bypass CDC report COVID-19 data directly to HHS. Okay, so I'm looking at healthcare IT news. I'm also looking at a handful of other sites because obviously something that's this politically charged, I wanted to see the different sources. We've also gone to the source. We have information from the HHS website, also looking at the American Hospital Association's announcement that they sent out to their hospitals as well. So let's take a closer look and see if all this craziness on Twitter is warranted. So what did they do? The Department of Health and Human Services today announced significant changes to the process for hospitals to fulfill the agency's request for daily reporting on bed capacity, utilization, personnel, protective equipment, PPE, and in-house laboratory testing data. The most significant changes are detailed below. Reporting options. The CDC and HSN COVID-19 module will no longer be an option for daily reporting as of July 15th. Hospitals are asked to use one of the other reporting options to fulfill the data reporting requests, including, number one, reporting data to their state health departments, provided that the states have assumed responsibility for reporting hospital data to HHS. Or number two, report to the HHS teletracking portal, an existing option for daily reporting. Okay, so those are the two options for reporting. If you have states like Oregon has put something together, Arizona has put something together where they are collecting this kind of information at the state level, I would assume, I don't know this for a fact, but I would assume that those states that are collecting that for state response are able to report that in then to HHS. So the data fields, HHS has made significant updates to the data fields it is asking for in daily reporting. All right, so let's just go to the HHS document, see what kind of fields, what kind of data they're looking for. So I'm looking at a document straight from the HHS website, which outlines this in detail. Here are some of the fields they're looking for. Hospital information, the usual, right? Hospital name, CCN, state, county, zip, you got it. The second thing they're looking for is all hospital beds. Third, all hospital inpatient beds. All hospital inpatient beds that are occupied. ICU beds, ICU bed occupancy. Total mechanical ventilators in use. Total hospitalized adults suspected of confirmed positive COVID patients. They also have subsets of some of these things. I'm going to bypass those. Total hospitalized pediatric suspected confirmed positive COVID patients, hospitalized and ventilated COVID patients, total ICU adult suspected of confirmed positive COVID patients, hospital onset, ED overflow and ventilated, previous day's deaths, previous days adult admissions, that's number 17, 18, previous days pediatric COVID-19 admissions, previous days total ED visits, previous days total COVID-19 related ED visits, previous days for remdesivir. I don't know why I have trouble saying that word, but I do. So current inventory of remdesivir, critical staffing shortages today, critical staffing shortages anticipated within a week, staffing shortage details. Are your PPE supply items managed? On-hand supply of individual units, duration in days. Are you able to obtain these items, yes or no? And they have a listing of items. If yes to the above, are you able to maintain at least 3 days supply? And number 31, does your facility use reusable, launderable isolation gowns? 32, indicate any specific or critical medical supplies or medication shortages for which you are currently experiencing or anticipating experiencing in the next 3 days. Okay, so those are the 32 items they're trying to collect. Nothing crazy here, nothing, this is what they need in order to put together a response to what's going on in each state as they surge, determining where they allocate resources, right? Makes sense. The AHA strongly urges all hospitals to review the announcement and report the data to HHS as requested. HHS stressed in the announcement the importance of reporting the requested data on a daily basis to inform the administration's ongoing response to the pandemic, including the allocation of supplies, treatments, and other resources. In addition, the agency notes it will no longer ask for one-time requests for data to aid in the distribution of remdesivir and any other treatments or supplies. Okay, so that's the end of that bulletin. That's essentially what's happened, right? So we were directing all that information to the CDC. Now we're directing it to the HHS. Why is that a big deal? Because the CDC data essentially is an open database that's available to researchers and everybody else. HHS is not as open. So that's the big catch here. So what's the so what on this? First of all, I think we have to talk about the CDC for a moment before we go into this. The first is, the CDC really had egg on their face from the get-go in the pandemic, right? So the COVID testing fiasco early on in the process came out of the CDC, and so they started behind the eight ball. The other thing is the CDC pandemic preparation from a technology perspective has been a topic on the show. They're asking for, in the beginning, they were asking for too much irrelevant information, and then their practices are still kind of antiquated, right? So there's still information going into the CDC via fax, via mail, not email, via mail, like stamp and, that whole thing. So they're still using that kind of thing as a way to collect. It's not outside the realm of possibility that the CDC is technology challenged and not able to produce the reports and information that are needed to effectively coordinate a response. Right? So that's not outside the realm of possibility. It's also not outside the realm of possibility that this administration would like to control the narrative, and the CDC and the data sources do not allow for that. So here's the thing. Is it a political move? Probably. But it is most likely not only a political move. It is probably also rooted in less than timely reporting, missing bad data, poor compliance on gathering the information. It's likely connected to the CDC's capabilities, the CDC's modernization of their platforms, their technology, their methods, their practices. It's probably rooted in both.